So brothers and sisters who are fit and healthy, no comorbidity risks, that means no underlying illnesses such as heart disease or diabetes or whatever. They should be adults, so it should be above the age of 18, and they need to be under the age of 60, because just generally we want to reduce the risk. Now, is there a risk? There is. This is not me saying that this is completely absolutely possible for every single person to follow this process. The Royal College of Pathologists in the UK, the Public Health England in the UK, the CDC in America, the EDC in Europe, a number of the professional bodies that are involved in postmortem and pathology have declared that the risk of transmission of infection of COVID-19 is low. It is low. It is not zero. There is a risk. That risk is primarily, as you're going to see when I demonstrate on the body itself, that risk is primarily coming from the bodily fluids that may come out during the ghusl, and any exhalation of any fomites, or rather any form that the virus may spread from the mouth or from the nasal mucosa. And for that reason, we want to make it clear that this is not without risk, which is why, of course, the guidelines from NHS PHE have excluded any vulnerable people, those who have these conditions or who are of elderly age. And of course, in our community, the majority of the people who fulfill this process are of the elderly, are 60, 65, the most experienced uncles and aunties or masajid workers. And so they are out of the game immediately. So we need a load of volunteers to come forward, and you'll see details of that spreading over the next few days in preparation for the next few weeks. We're expecting this to become a very serious problem. There's been some discussion about what is the minimum level of PPE that's required. It's important for us to emphasize the difference between what the government and what the local health authorities and the international health bodies are requiring for the preparation of the deceased versus what we would need for frontline health workers, those who are dealing with the living, those who are currently diseased, which is a huge risk, of course. And we know the scandal around the world because of the lack of PPE. But PPE is a very wide-ranging phrase. Personal protective equipment can range from the basic minimum, as you're going to see what we're going to use, versus that which we require for someone who is involved in what is known as an AGP, an aerosol generating procedure, which is in cutting into the body or intubating, or to get physically involved in the bodily fluids of someone who is diseased. And so surgeons and nurses in front line, paramedics when they're picking up someone who is coughing, spluttering, and in the process of worsening conditions. So those folks require full, complete PPE. This video is not about that. This is not about trying to train those folks. They know exactly what they need to do. The donning and doffing process for PPE, the fit testing for PPE, is really for those folks who are frontline. For us, according to the guidelines at the moment that have been released, and this is what this video was delayed to ensure that we can try to maximize safety. As I said, there's always going to be a risk. That's a full legal disclaimer. Those folks who are ready to take this job on, they're doing a great risk, they're doing a great service, of course. However, it is not as dangerous as people may think that it is. So before I actually don the PPE in an official way, I want to just give a demonstration of to make it clear what kind of availability there is. Again, this is not for front line. This is not for front line. This is just for the process of washing the body and handling the body of the deceased. You have everything from the bare minimum, which is simple plastic aprons. And I want you to appreciate that when it comes to plastic aprons, their job is really only because of splashback. That's the only risk in the washing process of the deceased. And this is what I will be actually using, which is the minimum guidelines. And of course, those who are more experienced in the washing process can feel more comfortable wearing that. But if you wish and you want to, and this doesn't cover your arm, this doesn't. So for example, you have these two. This is a proper surgical gown, which is what would be great if you have access to. And this is the normal kind of bodysuit that is sometimes used. So for example, they have buttons at the front, which you would put on. And it's full sleeve, and so therefore it covers your sleeves itself. But because it seals at the front in an imperfect way, it's just buttons in this manner. This is not giving you full protection, even if you were to complete all of the buttons. Okay, so you still have gaps. which means that you would then put an apron then on top of this to seal that part up. So you would then cover up like this if you are using something like this, which is opening at the front. If you are able to get a surgical gown, which is even better, then it would be the very first thing that you would put on. In the process of donning or putting on your PPE, after you have washed your hands, and again I'm going to do that properly on site, this is what you would put on. You would ensure that you put the sleeves in first, and then go around to the back, and then make sure that you have a double tie at the bottom and then at the top as well. So once you have something like this, then you do not need now an apron if you're using something like this. This is a disposable one, so any splashes that will come onto this, it will then be discarded. So this is with respect to the bodysuit. Now with respect to the gloves, the gloves are standard. The next thing that would go on would be your mask, and this is what's called a very simple surgical mask. All right, this is not what's known as an FFP3 or a mask with a respirator or an N95 as some folks call them. Those are what are required for frontline work. This is not what's needed for PHE, for according to PHE guidelines. When it comes to the washing of the deceased, this will be sufficient. This is sufficient. This is just a very simple mask that you would ensure has as good a seal at the top of the nose by just pressing down gently at the metal strip to give as much cover as possible. This is not airtight. You can feel the air escaping at every level. This is not going to be any use of any kind of, and this is of course why there's an outrage. Our doctors are having to work with these things, which is unacceptable, where there's a real risk of infection. The risk of infection from a deceased body is minimal. The tissue is the holding of the virus in dead tissue is not the same as in living tissue. They've not said there is no risk, but the risk is minimal, which is why they've said upon all guidelines, which you'll see attached, of course, to these documents and these videos, this is going to be sufficient for the washing. And what is its function? The function of this is only to ensure that splashbacks that might have infected viral material, is then going on the outside. The blue is the outside, and just to protect. And likewise, when it comes to eye protection as well, when you put on the goggles and visor, that is being done only again to just protect your eyes. If you are able to have goggles which are suction based, or a visor, then that's brilliant. But if you don't, it is sufficient for you just to be able to put on something like this, again, only to cover the risk from splashing when you are actually involved with the body itself. Okay, literally that would go on, and as when we do the donning and doffing properly, then you will see that go on. The last things that you will put on will be the gloves, which will be just normal nitrile, non-sterile gloves, which you will put on, and that will be the last final thing. If you are using a bodysuit, then this will then go over the sleeve of the bodysuit as well. So this is the process for actual putting on the different variety of PPE that's sufficient for this particular process. For me, you will see that I will be using just this. And most people who are experienced at washing will be using just this as a minimum, if they are able to, and I will be doing my sleeves like this. And that's because I will want to be using my hands only, and I will be ensuring that after the process I'll be washing my arms afterwards. But as someone like myself who is an experienced washer of deceased bodies, those who want to be more careful and you take extra precautions like using a full sleeve gown on top of your clothes, then that's of course even better. But you shouldn't be so petrified of the body and have such a fear. You shouldn't really be involved in this process if you're that worried, because there is a small risk, but that risk is definitely mitigated by the amount of material that you will see us put on in the next section. Okay, so now when it comes to what's known as the donning process, what you would use for frontline healthcare is different to what it is now. With the dead body, you do not need the same level of preparation. So, for example, you would be using an alcohol rubber every single moment, from between putting the apron on, putting the glasses on, etc., etc. Every single moment you would be cleaning your hands, washing your hands. In this process, that's not something which is required. Afterwards, when you're doffing, taking everything off, absolutely, because that's risk of infection from the body itself. But in this stage, simply washing your hands and being ready is fine. The first thing that would happen is, the first thing you put on is your body protection. That would be your gown, your surgical gown, if you put that on full sleeve, or as in my case, which is going to be sufficient. And as I said, an apron is only what is required when you are manipulating the body itself, then that's sufficient. So you would tie it at the from the back, and if it has a tie at the middle and then the top part, then you would do the same. In my case, because I'm not using a full sleeve, then I will then roll up my sleeves and make sure that it's secure. You do not want that to be falling down during the actual process itself. Here, I will be ensuring afterwards that I will scrub my arms in a very rigorous way with the soap, just like you do with the hands. And I want you to remember, every time that we are being asked by health authorities to wash hands, it's because we believe viral matter is being transferred upon the hands. This idea that I can't let the virus touch me or my body is nonsensical. That's the whole reason why you're being told to wash your hands, because it is everywhere. And as long as you wash your hands thoroughly, properly all the time, that is how you protect yourself. Again, I emphasize that there is no way that you can avoid risk entirely. After you've applied your apron or your body cover, then you will apply the mask. The mask should go on before you put on the eye cover, because it will be an easier fit. As I said, this is a very simple surgical mask that covers your mouth as much as possible. Again, a beard, for those folks who have a beard, is going to be then exposed, which will mean that as afterwards you will be washing these surfaces. You are wearing this because of splashes. If it touches onto here, you're not going to get infected immediately from any splashback that goes onto a beard. Whereas if it went straight into your mouth or into your nose and it's then inhaled, of course that is going to lead to infection. That's the reason we're covering the nose and covering the mouth and then covering the eyes. Here you'll need to wash afterwards when you get home. And that's something, of course, as many of the scholars consider to be a recommendation, to wash. And then you will put on your eye cover, and now you are ready to actually perform the ghusl itself. The next stage is then receiving the body and then putting it onto the table for washing. Okay, so for those folks, just to add, those who are concerned about their beards, now the beard being exposed at the bottom part, as you saw in the previous image, is as is slightly greater a risk as the exposed arm. You'll need to wash this, but obviously this being closer to the mouth, you might want to cover it. It's not obligatory if you want, but again, just from a safety point of view. So you'd either use a beard protector, which is the same that goes over the head. And remember again that you should wash all of your clothes at the end of the day, just to be on the safe side. If you have a beard protector, it's great. If not, then you can just use another surgical mask. You'd put it over the ears. You'd fold your beard into it as best as possible. And then you would then apply the second one over. Just look in the mirror and tuck in as much as you possibly can, just to reduce the exposure of the beard. This is again just an added precaution for those people who want to ensure that their face and their surface areas of whether their beard or whatever is minimal exposed to any splashback.